For the last 8 years, I have worked and studied in the field of global mental health, from the urban mecca of Johannesburg to the isolated villages of northern Vietnam. I have journeyed to improve the lives of others and learn about mental health in an extraordinary way. This is my UW story. Hi, my name is Rachel Rinehart. I'm a fourth-year medical student and Master in Public Health candidate at the University of Washington. In the spring of 2015, I was a sophomore in college, sitting in our Genome Sciences building and listening to our first lecture on global mental health from Dr. Deepa Rao. She was giving stories about how people in different countries and different cultural concepts have different health outcomes and mental health presentations. I was pulled in from each of her stories because of the different ways that people's backgrounds can really affect their health. Over the course of the next 2 years, I took every opportunity that I could to learn more about global mental health. I found a graduate level course in psychiatry, and I started doing research with a mentor in Peru. During that time, one of the greatest things that happened was the UW Bonderman Travel Fellowship. This was 8 months of funding to travel around the world. The only rules were that I had to travel by myself, I had to go to at least 2 continents, and I couldn't return home at any time. I was committed to making the most of this opportunity by examining mental health in each of the 9 countries that I visited in Africa and Asia. I did this by meeting with doctors, researchers, organizations, and community members of each of the countries that I went to. This was actually inspired by a study abroad I did earlier called Psychology Chile, where we went to 22 different medical sites and looked at how mental health is treated all over the country. Over the course of my 8 months in Africa and Asia, I met with countless people and explored every medical site that you could think of, and a few that you might not think of as medical sites at all. One such location was a Buddhist monastery in Vietnam, which I joined for a week to study mindfulness and meditation, which is an emerging treatment for mental health care. Perhaps most importantly, I made connections with people who continue to influence my career. I've helped out with research in Tanzania because I still have friends there that I care about. These same friends from the Maasai tribe helped me learn Swahili, shared with me their fears of Western hospitals, and communicated their beliefs that mental illness can be cured by having a shaman come into their home to release the bad spirits. I started medical school determined to become the best physician possible for my community here in Washington and my new communities abroad. In 2021, when the COVID-19 pandemic hit Africa, I learned from my research group in Rwanda that thousands of psychiatric patients were struggling with care. I made the difficult decision to take time off from school so that I could complete a research project with this group, which was funded by the UW Global Mental Health Fellowship. To the surprise of the research group and me, we found that the biggest barrier to care was actually food insecurity. People were having to choose between a meal and taking their medications. So we shifted our efforts to nutrition, and we're still working on that today. Medical school and the Masters of Public Health have continued to accelerate my learning. Going to a variety of different hospitals in the 5-state region of the University of Washington School of Medicine has given me the opportunity to see different kinds of healthcare systems similar to when I was traveling abroad. Additionally, the Masters in Public Health, specifically global health, has been a great way to meet colleagues from all over the world. We work on projects in the classroom and outside of classrooms that are applicable to real life. It has been an honor to return to the School of Public Health and learn from faculty like Dr. Rao. As I move forward in my career, I will continue to work with innovators to solve global mental health problems here in our state of Washington and abroad. As Dr. Rao likes to quote, "The global in global health refers to the scope of the problems, not their location." I'm grateful to bring all that I have learned from the University of Washington and around the globe to my work as a future psychiatrist, researcher, and health advocate. Thank you.